For my case presentation, I decided to do the case Stange versus Janssen Pharmaceuticals. So we'll start with a little bit of background. So Janssen Pharmaceuticals was founded in Belgium in 1953 by Dr. Paul Janssen. Dr. Paul Janssen was the son of a family practice physician who set out to create a medical research laboratory that began in Belgium but was later procured by Johnson & Johnson in America. At the time of this suit that we're going to speak about, they had employed approximately 28,000 people globally. The research laboratory, they set out to create drugs essentially that would treat different specialties, different diagnoses and different specialties, with one being neurology. They, in the year 2013, I have a chart that shows the multiple billion that they made at the end of the year, the end of the fiscal year, in accordance, or in addition to the billions that they made, they were actually ranked 7th in terms of the largest profitable company in the world for pharmaceutical sales. There's also a pie graph, as the fact that they don't have numerical value, however, the portion is correct. The proportion is accurate. So when looking at their total sales, 69% of their total profits came from pharmaceutical sales. So a huge part of their profit was the sales of these drugs. One of which they created was called Risperdal. So then we'll talk about Stange for a bit. So Stange is a 12-year-old boy at the time who lives in Wisconsin. In 2006. In 2006, he was being treated by his neurologist, Dr. Kovner, for Tourette's syndrome. And at the time, one of the treatments for Tourette's syndrome was a drug called Risperdal, that was created by Janssen Pharmaceuticals. So along with every drug, there's obviously a label with side effects. So we rely upon the label to have adequate and correct information regarding the risks involved with taking that medication. So the issue at hand is the inadequate risk descriptions from Janssen Pharmaceuticals for this drug Risperdal. The risks that were listed states that 1 in 1,000 patients have the potential to develop gynecomastia after consumption of this drug. However, the accurate ratio was actually 50 out of 1,000, and Janssen had scientific data to support this 50 out of 1,000. Now, why they finagled those numbers, in regards to the risks that they were supposed to disclose, we're not sure. Was it for financial gain, being their largest income was from pharmaceutical sales? We don't know. However, regardless, so for Stange's timeline, diagnosed at 12 years old, began taking Risperdal at 12 years old. A year following the medication consumption, he has documented, or it's documented that he complains of breast pain, in specific, nipple pain. So fast forward, he's now 17 years old, and at this point, Stange is formally diagnosed with gynecomastia. A year following that diagnosis, he decides to undergo a double mastectomy to remove both of his breasts. The areas to focus on. So Janssen Pharmaceuticals was aware of the side effect of gynecomastia. So, and when looking at this case, we also learned that there was approximately 55 other patients who had also complained of the side effect of gynecomastia following this treatment with Risperdal. However, again, the issue at hand is the failure to disclose this information and inadequate labeling that results in product liability. So moving forward, the rebuttal for Janssen was, the patient developed gynecomastia, but was it really from the consumption of Risperdal? had 2 feet to stand on when they argued that there were no experts, no physicians who could directly link this diagnosis of gynecomastia to the consumption and the treatment of Risperdal. The other thing they brought up was the fact that the timeline they felt as though was off. So when he was 12 years old, he began taking this drug and didn't have a double mastectomy until the age of 18. And what also comes into play is the fact that throughout those few years time span, he was also diagnosed with obesity. I didn't see where they got much into the details about the obesity, but depending upon what level of obesity it was, he could have potentially developed gynecomastia from that. Also, the fact that those were within those ages from 12 to 18, he also underwent puberty. So was it a pubertal gynecomastia development? They didn't really delve into that much because at the end of the day, in the court of law, a plaintiff who has established both a duty and a failure to warn must also establish causation by showing that if Timothy Stange or if Dr. Kovner had been adequately advised, adequately warned, then they would not have moved forward with this type of treatment with this drug. At that point, the question was from the courts, Dr. Kovner, would you still have prescribed Timothy the Risperdal in efforts to treat his Tourette's syndrome should you have known the actual risks involved? He answered no. So he felt as though the risk of the medication did not outweigh the benefits. And he said that he would not have chosen to treat Timothy with that drug should he have known the actual ratios of the development of gynecomastia for patients who consume it. On the flip side, they also asked Timothy, should you have known the risks involved, should you have known that you would potentially have been in a position where you were ending up getting a double mastectomy, would you have moved forward with the consumption of the Risperdal to treat your Tourette's syndrome? He also said no. So at that point, in the court of law, they had answered the questions, and now they're seeking financial gains because of the both emotional and physical scars that were placed upon him in terms of the bullying, and the physical scars being the double mastectomy that he had to undergo. So they were searching for financial compensation, which they did get. Overall, I do agree with the results of the case because I think that the risks should have always been very clear in the labeling. I think that was very strategic of them. I don't think it was an accident. So I think it ended how it needed to.